Coming up, we are smack dab in the middle of October, so that means we are thinking pink all month long.
It's Breast Cancer Awareness Month, of course, and after the break, we're going to take a look at the simple, healthy lifestyle choices that some medical experts say can help prevent the disease and improve survivorship in women who have already been diagnosed. The doctor's in next. October is Breast Cancer Awareness Month. Now, that is the most common type of cancer among women in the U.S., except for skin cancer, according to the American Cancer Society.
It accounts for roughly 30% of new female cancers every year. Some experts say that more than half of breast cancers can be prevented with healthy lifestyle changes. It can also help increase survivorship in women who have already been diagnosed.
For more on this, let's bring in Dr. Lorraine Frazier. She is the Dean of the School of Nursing at Columbia University, as well as a breast cancer survivor herself. Dean Frazier, good morning. Thank you so much for being here.
Good morning. It's great to be here.
Wonderful to meet you. And I do want to start, if you don't mind, on your personal journey, because I imagine it's quite something to go from caring for patients to being a patient. And you underwent a lot of treatment. Tell us about your journey with breast cancer.
Well, I was surprised, of course, but well taken care of. You know, I had professionals helping me through. I had the best physicians and the nurse practitioners in oncology that were there to answer my questions and to help me along this journey. So I felt that I was in good hands, and that made a big difference.
Tell us about some of these lifestyle changes that you can make either to prevent breast cancer or if you are diagnosed to help you on that journey toward recovery.
Well, you know, that's the exciting part about my journey is before I was overweight, but I'm 5'10". I mean, I wasn't, you wouldn't say I was heavy or obese.
Right.
But taking that weight off is important. Weight is not your friend with breast cancer. But it just doesn't mean weight, it means developing muscles. Now, a lot of times you lose weight when you're going through chemotherapy, but you have to build back those muscles that really keep your body healthy, keep that insulin sensitivity up, keep that glucose down. And so, you know, just exercising. The other thing is eating well, you know, knowing what to eat protein, eat good vegetables. I totally changed how I was eating.
Wow.
So exercise and eating really gave me a new body, which I love. I love my new clothes and getting dressed up. And also dealing with stress. You know, I don't let drama get into my life like I used to. I have a different sense of what's important. And I put myself first. And I think for women, it's hard to do that sometimes. So I think that made a big difference.
Some of that is a little easier said than done, right? I think for a lot of women, probably just hearing like losing weight, like, oh, well, I've been trying that, or something like that. And same with drama, you know, you think you can strip it out, but maybe sometimes you can't really anticipate how you'll react to something.
Yes.
What's your advice to women on how to really make a shift? Maybe especially if they haven't had a diagnosis.
That's a great thing to talk about. You don't have to do excellent. Sometimes the best you can do is enough, right? Exercise can be getting the kids out, cleaning the house.
That's a great
Whatever
idea.
you do, remember, it is exercise. 5 or 10 minutes after you eat, walk around the block, get a pair of 5-pound weights. That's all I do, and work out on your weights. If you can do things like that, you can get in shape. It doesn't require a gym.
You say that you used to feel like you were sort of leading your life on a conveyor belt, just kind of letting things kind of go by you.
Yes.
And this has changed all of that for you. That's why you wanted to share your story so publicly, right?
Yes. You know, Alice in Wonderland says, don't ask me who I was yesterday. I was a different person. I was a completely different person.
Wow.
I noticed things that I wouldn't have noticed before. The beautiful sunrise. If you saw it this morning in New York, it was fabulous. And the other thing, though, that we haven't mentioned and I need to talk about is taking your medicine.
Oh.
There is a medication, an estrogen blocker. If you need to take that, take it. It prevents recurrence from 30 to 60%. Sometimes it's difficult if you have side effects, but work with your practitioner and make sure that you take that because it's really, really important. I take mine. I will be on that for 10 years, and I find it's very worthwhile.
Dean Lorraine Frazier, what a great message. Comforting,
thank
I'm
you.
sure, to anyone with a recent diagnosis to know that you have some control. There's some
You
things
do,
that
and
you
it
could
could be the beginning of your best life.
There you
It has
go.
been for me.
Thank you for joining us
Yeah,
this morning.
yeah, thank you.
Wonderful to see
Thank
you and meet you.
Yeah.